we're doing Menopause and Murder in Australia again.
Yep.
And we won't talk about the mushroom murder. We really won't talk about that because, you know, we don't want to get you fired or anything like that. But I did think it was rather timely. And because I saw how old she was and went, But anyway, I digress. But because, you know, we might have another new listener, let's introduce ourselves and get into it. So I'll go first. So I'm Vicky, and in my day job, I manage a neighbourhood centre and a community centre, and we deal with people in crisis. And my conversation with you started out specifically around women in crisis and what I've been seeing. And so we did our first video, Menopause and Murder in Australia, a couple of weeks ago, and we talked about that. So if you haven't watched that, our new listener out there, then go watch that, and then this might make some sense. But anyway, so, and you are?
Oh, yes, it might make some sense, yes. And I'm Sarah Nunn, a GP here in Brisbane, and I do some work specifically in women's health.
Yes, you do, and you're very good at it. Anyway, I want to follow on from our video of last week and talk about, you know, the symptoms of perimenopause and menopause and stuff like that. And one of the things you said, which I thought was really, really good, was basically anything new. You know, like all of a sudden you've developed road rage and you've never developed that before. And I know for me, and this is the benefit of hindsight, because nobody in my medical team, if you like, made the correlation. But I know for me, actually, what the beginning of it was inflammation. And because that was new. But because I was playing sport, I thought it was sport related. But I've come to know in my research, and like I said, with the benefit of hindsight, that inflammation is actually a huge sign or symptom of menopause. Yes, I will say that it's also a symptom of other things too. But I can say for me, when I track it back, it started with inflammation. And it wasn't until, you know, I went further along, seeing a doctor, doing this, other things cropped up, you know, menopause related or perimenopause related. And it wasn't until I put it all together, did some research and found out, so I'd really like to talk to you. And this is knowing that every woman is different, everyone's affected differently. But in your experience and with the benefit of hindsight, and given that both you and I've lived, are survivors, I call it survivors, you call it a lived experience, I call it survival. Anyway, what can we talk about some of those early things to maybe have women start thinking about whether this is hormone related or not? I mean, or that the conversation with their GP should be, let's check our hormones too.
Yeah, I mean, it's interesting because if you search the literature, it still says that the number one symptom of symptoms of menopause are the vasomotor symptoms, which are your hot flushes and your night sweats. And I was interested, just even today, I thought I'll just take a quick break and see what, you know, the internet has to say. Because I'm a little bit of an idiot, I typed in what's hot in menopause this week.
That's a whole other site, that is. delete.
No, what's hot in menopause in this week is you're hot. you're sweating and you're dipped in oil, not hot. So that didn't go well. And then the next thing I thought was, okay, so what's topical in menopause this week? Well, of course, estrogen is topical in menopause this week. So at that point, I just thought, I'm just going to wing this because I seem to be making faux pas. What's hot in menopause this week?
At least you're putting menopause on it, because this could have gone a whole other way if you were like, what's hot for women today?
Yeah. I wouldn't have been able to relate, though. I would have been very confused. And then there's always the possibility that someone comes along and uses my computer after me, and then I get fired.
What
No,
the feds are knocking on the door? Like, is there a Dr. Sarah Nunn here?
Horrible misunderstanding.
Well, couldn't you blame that on like brain fog?
Yeah.
Like, because isn't that freaking one of the biggest symptoms? It certainly was one of mine.
Oh yeah.
Well, maybe not the biggest symptom, but it's a symptom.
Oh yeah, absolutely. And it's kind of funny because in some ways, the brain fog actually makes it hard to fit all the pieces together. It's like fitting together a jigsaw. And so you've got someone sort of staring at all the pieces, but because they've got brain fog, they can't quite, make the picture. And so sometimes those conversations are really they just don't follow any kind of textbook. It is a little bit like us today having a chat, Someone comes in, yes, absolutely, joint pain, my lower back's hurting, and I've got new RSI in my hands, but I type a lot, so, have I got carpal tunnel? And then you might ask them about, I don't know, any other symptoms that they've experienced, and it's one of those conversations that can't really be rushed.
No.
It's because it all has to fit together in its own time. And I think there's no point just announcing to somebody that you've wrapped it up in a nice little neat bow and that's the end of the story and off you go. So it's not kind of that. It's just not that easy.
Well, menopause isn't tidy in a little neat bow. I mean, you dropped that bombshell in our last video about this stuff. It could last up to 10 years. 10 freaking years. Oh, my God. I had to have a lie down after that too, by the way.
Yeah.
And, but, it's the key is new, isn't it? But I think... Yeah. On that, though, I'll say that because I've lived my adult life with endometriosis, so I've lived in pain, basically. It was just like, ugh, it's just another thing. Didn't think about that. And then, like I said, I was playing sports and stuff like that, getting older. The excuses I made for myself. And so I didn't really talk about it with my doctor like that, until it became like I'm going crazy.
Yeah. It's an interesting conversation. So if someone comes in and it may be as diverse as joint pain, increased anxiety, feeling crazy, and then you might say something like, and so what are your periods doing? And people will be like, well, what's that got to do with,
Yeah.
why are we talking about my periods? But often that is a place where a lot of women will say, oh, well, it's interesting you should say that because they're now really irregular, they're heavy, unpredictable, really disruptive. And again, that's like, I think a light bulb moment in terms of what you say about things changing that are obvious. You can't, you can talk yourself into joint pain. Yes, I'm getting a bit older, it's a bit cold. You can probably talk yourself into a bit of anxiety. I'm under pressure at work, or my relationships seem to be a bit tenuous.
There you go, being polite again. I want to stab my husband.
Yeah, but then you can't. Again, everybody's different, but you can't. That's one of the giveaways is you can't think yourself into irregular and heavy periods. That's
And that's so
obviously
true.
something. And that's what you rightly said before about the difference between a sign and a symptom.
Mm.
So a sign is typically something that you can sort of objectively demonstrate, whereas a symptom is subjective. And there's a big difference between, so if I say my hands are sore, unless my hands are swollen and red and, you know, there's something to see, then it's only my subjective interpretation of that, as opposed to a sign, which might be a blood pressure or, you know, something that you can objectively demonstrate. So I think that's really important. In some ways that is about backing yourself and saying, no, actually this is happening. I'm pretty sure. Just because you can't stick a thermometer in my ear and get an abnormal temperature, that doesn't mean that this isn't happening for me, and that those ranges of experiences aren't quite real. And I think that was one of the messages I wanted to get out around perimenopause, because it is a little bit insidious, and it might start before you think it's going to start. You might read some literature that says when you turn 50, you can expect some hot flushes and night sweats. And then you've got someone who's 42, and those other, you know, they might be tired, they're not sleeping very well, and sort of what's behind that. It can't be menopause because I'm too young.
Well, it's so true. And, you know, again, with the benefit of hindsight, like for a start, I've never had hot flushes. So I'm postmenopausal, and hot flushes weren't part of my story and aren't part of my story, and better not be part of my story moving forward.
We'll see next week.
10 years.
Let us know.
Oh shit, I'll tell you. But yeah, hot flushes weren't part of my story. Thank goodness, touch wood, like seriously. But you know, inflammation, brain fog, and oh my God, I'll tell you what, the itchy frickin' ears, like I reckon I've scratched out the inside of my ears to a great big, you know, like almost near my brain. It's that bad. And I still don't understand the correlation. I still don't understand what my reproductive system has to do with my ears. But anyway, you know, like then it gets into that talk about the dry skin, this. So I've had quite a lot of that superficial, but it's not. I mean, I don't even know what the word is for that. And then in terms of irregular periods, I've lived with endometriosis. So I don't know. I've had periods. Then I've been going through perimenopause since I was 18. If that was the sign, do you know what I mean? So I think, like you say, it's about what's new. I think for many normal women, if there's such a thing out there, periods would be a clue. If they've suddenly, you know, it's been what it's been, whatever that is, for however long, and then suddenly it's taken a turn, whatever that is, but it's different. And then one of my staff members at work, Lisa, she's got abnormally high blood pressure, and like through the roof, triple digits on both sides. And she's been that's been spoken about with her in terms of hormonally charged, you know, and so she's on estrogen, all the rest of it. We talked about frozen shoulder last time, but I've had a look on the internet, and we'd be here all night if we talked about all the different symptoms that women go through that can be attributed to hormonal changes in the body, from perimenopause to menopause to postmenopause. And like you, I really want women to start thinking thinking about the changes in their body and being assertive in their healthcare with their medical professional. And I know I had to, once I started to add it all up, I had to go and search a doctor that specialized in women's health / menopause. And I found a doctor, and she was really efficient and all the rest of it, but I still wasn't entirely happy, and actually ended up getting more benefit from my male gynecologist. And I see a gynecologist every year because I have the HPV marker, so I have to get my smears. He has to go blah blah blah. And I'll tell you what's really pissed me off. I've had a radical hysterectomy, and I still have to have smears. I'm just like, what? I thought I got rid of the problem. Are you kidding me? I'm like, I did say to him jokingly, "You just like looking at my vagina, don't you?" But it's possibly not the best thing to say to a gynecologist. Anyway, let's go back to new things. New things. Now, you're the doctor. You see ladies, and potentially they're not seeing you when they're new. They're seeing you when they've had enough.
Yeah. Oh, yeah.
Yeah. But what are some of the prominent signs, symptoms that you're seeing in your practice?
One of the ones I don't know that we've talked about too much, or maybe we haven't, I've blocked it out, and that's the central weight gain, the change in fat distribution and weight gain. Again, the literature is not all that ready to just lay that at the solely at the door of menopause. So I think it probably is, multifactorial. If your knees are aching, you can't get out and walk, and maybe in response to that, you feeling a bit anxious and down as well. Stress. And so you go and feel a bit stressed, and so you take that out on a cake. So,
or in my case, a bottle of American honey.
Oh. Yeah.
But that's
sort
so true. And I, literature. Nobody's ever asked me to add to any literature, because I'll absolutely tell them one of the first things was to weight gain. And I was playing sports, still eating, what I was eating. Nothing. I hadn't deviated from. I'd plateaued for years, and I still had not deviated from that. Like I said, still playing sports, still doing this, that, and the other thing. And then I started to gain weight. And now I've had a gastric sleeve. I had that, I don't know, whatever it was, 12 years ago. So weight is a real mind fuck for me. And it hits me. And so when I started gaining weight, this was actually, now that I remember, this is when I first went to the doctor. I started gaining weight. I'm not doing anything different. I can't be doing this. You need to give me something. And went through the whole Duromine, went through Ozempic, didn't make a difference, just stuffed me up some more. And then again, once I finally added things up, hormones. But I have to say, at my age, at the time, and I was in my 40s, in my mid to late 40s, we never had a conversation about hormones. I go in, I'm really worried about weight, and I'm particularly worried about it because I've had a weight issue before. So I'm real hot on this stuff. And I'm saying to her, I have not changed anything. Oh, well, age, Surely then, if the answer is going to be age related, then it must be, for a woman, also hormone related. Let's have that conversation. And we need to be assertive with our healthcare. And I think doing these videos and having women think about, just really track some stuff and go, well, you know what, that's not normal for me. or I haven't changed anything. I might go and get my hormones checked. But I do know at the early time when I was getting my hormones checked, there was one thing she didn't check, something like testosterone, maybe. She did a range of tests, but it was one key hormone thing that she didn't test. And then when I questioned it later, she tested it, and then, oh yeah, maybe you need a bit of an update. I was like, well, why isn't this all part of the package? Why do I have to keep asking questions and prodding on this? So one of my big purposes for doing these videos is that other women don't have the experience that I did. I'm not here to bag the medical profession, not here to bag a doctor. What we're here to do is educate women to start thinking about the changes to their body and being assertive with their healthcare and getting their hormones checked, right?
Well, yeah, yes. Just remembering, though, one of the things that can be really confounding from a medical perspective is that the hormones will fluctuate. We sort of touched on last week that one of the hallmarks of perimenopause is where the ovaries start to run out of eggs. And because the ovaries are running out of eggs, they're not forming follicles and therefore aren't producing estrogen, except when they do.
Yes.
So what we know is that, yes, of course, low estrogen causes the symptoms of perimenopause and menopause, but so does high estrogen, and so does bouncing between the two. So you've got, someone who's got lots of symptoms, and say, for example, their estrogen comes back high. Well, you might think, and the patients think, oh, well, I'm wrong. But you've got to, none of these numbers exist in a vacuum.
No.
Like if you think about any of the numbers in pathology, you can potentially make them look really pretty on the screen. Does that matter? Well, no, it doesn't matter.
It's only a snapshot of the day that test was taken. And you and I have had this conversation before. And again, I think from memory, our conversation was more about, it's more about how are you feeling? Yeah. What's going on for you? Yes, we can do this test, but that test is only going to show what's going on for you when you take the test.
Yeah.
It may help you as a doctor give you some indicators, but it's still only going to be a clear show of what's happening right there when they took the test. And 2 hours later, it could have been completely different.
Yeah, and there's no test that's ever going to be 100% accurate. So, maybe it depends on the person that drew the blood on the day. How long was the blood in the car on the way to the lab? Is the machine in the lab working, or has it lost its tiny mind? So, try not to. If you get a result that's kind of an outlier, you have to think, well, is it? What else is going on? I do think it is important, though, when the GP's testing or the gynecologist is testing, that they don't ignore other things that might be going on. So, for example, an underactive thyroid.
Yep.
And one of the other things that happens with women sort of in their mid to late 40s is that they develop iron deficiency because they've suddenly got really heavy periods and they just can't keep up with their iron. So those things need to be factored in because those things are treatable. These days I've got iron infusions. So instead of someone just kind of being exhausted and see-through, well, you don't know how much of, until you correct, for example, an iron deficiency, you don't know how much that might be playing into the overall picture as well. So it is sort of the whole woman in that setting. The other thing that I kind of did think about this week, when I was Googling what's hot in menopause, was also raising awareness of what can be done in that setting. Now, I speak to a lot of women, for example, most women will know about Mirena, the intrauterine device that can stop bleeding, for years, and for a lot of women does. But then there's things like endometrial ablation, where that's non-hormonal, and the lining of the uterus can be cauterized. I mean, if you're not using it anymore, then
Get rid of it.
do you really need it? And I would say absolutely not.
Well, not if it's causing issues, for sure.
Yeah, but that is a surgical option, and any surgical option is going to have inherent risks, and it's not hormonal though, so it could be a real option for a lot of women, and they just haven't heard of ablation. They think their options are Mirena or hysterectomy.
Yeah.
And that's certainly not the case. And that's part of what you're saying about raising awareness, not just of the symptoms, also knowing that, unlike maybe generations gone by, there are more and more options.
Yeah. Well, that's so true, because my view on it was really narrow, and as much as I was doing research around symptoms, and then I was doing research about HRT or MHT, whatever mood we're in today, because I, like surgery, I never even thought about surgery or anything like that. And then on that, I'd like to ask you a little bit about that, because, like let's pick one, inflammation. So I've had inflammation now for years. It's just, and it's worse on some days. There are things that can exacerbate it and all the rest of it. And it fluctuates, but it's present all the time. And so I'm on estrogel, topical estrogel. I put it in my arms, and I have 3 pumps. And 3 pumps keeps me relatively sane and normal. And sometimes I can feel the difference in the inflammation, and, and my body's coping with the inflammation. But I'm just like, do I need to lather this freaking everywhere to make this stop? I mean, is it unrealistic of me to think, like, I'll keep taking this and the inflammation's going to go? Is the inflammation going to go? Is it ever going to go? Is estrogen, is HRT going to help that inflammation go, or does it just help me stay above the water? Because that's all I'm feeling like right now, to be honest, like that I'm just staying above the water, that it's manageable. And I've already cut out things that I know exacerbate it. And but I can't cut those out. Like, one of the biggest contributing factors is alcohol, for sure. But I still want to have a life. And but by God, do I pay for it? I absolutely pay for it. And then I'm like, maybe I'll just do an extra squirt of estrogen. But I don't actually think it works like that. I don't know. Tell me how, like the treatment, the HRT treatment, is it only good for some symptoms, or is it, we're never going to get the same amount of estrogen that our body normally produces, would you say?
Yeah, and it's we've talked about estrogen a bit, but you kind of touched on testosterone, and then there's the other culprit in the room, progesterone.
Yeah.
And so there's, and that's interesting on many levels. Not and again,
I can see you trying to be tactful.
I am trying to be tactful. So hard to be tactful. So very, very hard. I have a friend who's menopausal, and her doctor, he loves it when she brings up what I've said. So she's and Sarah said, and then he twitches. because, we don't traditionally offer, for example, progesterone to women without an intact uterus. So you get your estrogen, you might get a bit of testosterone, but you only get progesterone if you have an intact uterus.
And
the thinking around that is that the progesterone protects the lining of the uterus, and you don't get unopposed estrogen, and therefore don't get uterine cancer. Good. I do sometimes wonder, though, for example, about the other potential benefits of progesterone, and I'm not sort of advocating that anybody, bails up their doctor and demands progesterone. At the same time, though, I have noticed that, for example, there's a medication called tibolone.
Oh, yeah.
And you can use so tibolone has estrogenic properties, progesterone, testosterone properties, and it is used in women who've had a hysterectomy. So I'm a little, so it's still, I think, a watch this space. I think we've come such a long way to be having a conversation like this. My sense, though, is that there's still some gaps in treatment that will potentially be filled. Well, I'm pretty sure they'll be filled. But we're still dealing with the hangover of, the studies that were done then in the 1990s and 2000s, and still dealing with the hangover. So I have a journal sitting in front of me that talks about menopause. Now, they can't ignore some of those studies that did associate estrogen with increased risk of breast cancer and blood clot. And then in the very next paragraph, they're at absolute pains to point out that transdermal estrogen, which is the gel that you talk about, does not come with those risks. So our language is still, in my view, quite confusing.
Geez, if you're confused, then we've got no freaking help. We've got the shit show in hell of trying to work this out.
Yeah, I don't know. Part of me, look, I mean, back to the literature. I spend a bit of time reading the literature, and maybe the literature is deliberately obtuse in some settings. Maybe you just get a researcher that's having a very bad day.
Well, I can tell you nobody's ever researched me, and I'm not sure they'd publish those findings. They might just put that down to at worst case.
Well, that's a good point too, and I do wonder that sometimes. I mean, who are these people that are being studied? Because I don't know any of them. Nobody seems to want to.
That's so true. Well, listen, I know we wanted to keep our videos, half an hour, and we're at the half an hour mark, and I think this is definitely, I think the summary here is new like new things, new irrational things or abnormal things or something that just makes you go that's not right. And then the other part of the summary would be about being assertive and not writing things off, like go and get tested, go and ask the questions. You're also, you can shop around for medical practitioners if you're not feeling heard. But really, any female over the age of 35 experiencing anything different, and literally anything, your hair starts falling out, your ears get itchy, hot flushes, freaking abnormal bleeding, weight gain, inflammation. Oh my God. I mean, it goes and goes and goes. But if that's not normal for you, then go and get it checked out, because I don't want anybody to go through what I went through. And so the earlier we can get onto this. And I know another thing you want to talk about eventually is around puberty too, and about getting onto that stuff early as well. We've had a conversation about that a long time ago, and I dare say we'll get there. It just early intervention or early support, so people don't end up, I don't know, feeding their in-laws mushrooms, just for argument's sake.
I'm gonna get fired tomorrow. I know where you live.
I'm sorry, but anyway, that's entirely just me right there. Anyway, we shall do this again and continue this conversation, but thank you again for your time and for you reading all that literature for us, so that you can educate us better on how to manage this whole getting older business.
Yeah, just never tell a menopausal woman to just lose weight.
Oh my God, no.
Get yourself killed. Anyway.
Yes. Anyway, well, you go and have a good night, my friend, and we'll speak again soon.
Okay. All right. Thank you.
Bye. Love you.
Bye. Love you more.